Hi, this is Starla. Today we're going to be discussing the signs and symptoms of active labor. Probably the most common question that all women have at the end of their pregnancies is, how will I know if I'm in labor? Many women worry that they won't know whether they're going into labor or not. But I can promise you, it's not like they show it in the movies. Whether it's your first baby or you've had a couple babies before, sometimes it can be confusing as to whether you're in labor or not. It's normal to start feeling some changes in the end of pregnancy that can indicate that your body is getting closer to going into labor. These can include the baby dropping, which is called lightning, increased vaginal discharge, which is mucousy or blood tinged or pink tinged. Can also be a big burst of energy, which is called nesting. These signs can even start happening a full month before you go into labor. One of the most confusing symptoms that women have are contractions. These are tightenings of the uterus, and sometimes we can feel them and sometimes we can't. These can really happen anytime, like when your bladder is full, like when the baby's moving or you're moving around a lot. Can also happen if you're not drinking enough water. These are called Braxton Hicks contractions, and they are not a sign of active labor. But when the uterus starts contracting regularly and more frequently, say every 3 to 5 minutes, and those tightenings are getting stronger and more intense, that, of course, is a sign of active labor. These contractions will cause the cervix to start to open, which is called dilating, and thinning out, which is called effacing, and the baby moving down into the birth canal, which is considered station, which indicates where the baby is at in the birth canal. Some other signs and symptoms of labor might be, 1, maybe lower back pain or cramping that doesn't go away with taking a warm bath, or drinking some water, or taking some Tylenol, maybe lying down and resting. Number 2, maybe your water breaks. Number 3, maybe you start to have a mucousy, red-tinged or brown-tinged discharge. Remember that just one of these signs or symptoms does not indicate active labor, but more so a combination of these. So what about your water breaking? How will you know if that happens? It's not always easy to tell if your water breaks, but for most women, you'll have a big gush of fluid, or you'll start leaking a clear or straw-colored fluid. It doesn't smell like urine, and it doesn't smell bad usually, and this fluid just is uncontrollable. It keeps coming out, and there's nothing you can do. It's not like emptying your bladder. You can't stop the flow. One little test you can do at home if you think your water might be broke is to go in, empty your bladder the best you can, put on a little peri pad, and then be up walking around and doing stuff for about 30 to 45 minutes. If that pad is soaked within 30 minutes, it most likely is your water. If not, it may be just urine. But if you have any question or you're unsure, you definitely need to get a hold of your provider so they can do a quick, easy test to see if it really is or isn't your amniotic fluid. Knowing whether you're in true active labor sometimes can be difficult, but if you're unsure, get a hold of your provider. They can help you determine whether you're in labor or not. Even if you're not close to your due date, if you have a combination of any of these symptoms, you need to get a hold of your provider. It could be preterm labor, and that needs to be addressed immediately. As always, thanks for tuning in. And if you'd like more information, go to my post at 307midwife.com. Stay healthy and have a great day.